In our Scripps News Tonight focus, we want to shed a light on the maternal death rates in our country. Specifically tonight, Black women who are at the highest risk. Let's look at the numbers here before we get into the conversation. This is from a JAMA study spanning the years 1999 to 2019. In Ohio, Black women are more than 5 times as likely to die from pregnancy-related complications than the state average. The overall maternal mortality rate rose from 10.7 deaths per 100,000 live births in '99, and it's gone up to 10.8. The Ohio Department of Health found 57% of the state's 186 pregnancy-related deaths from 2012 to 2016 were preventable. Nationwide, maternal mortality rates more than doubled between those years, going from 12.7 in 1999 up to 32.2 per live birth 100,000. So tonight we want to personalize this, speaking with someone who knows the risk, the experience firsthand. Dr. Bio Curry-Winchell is a friend of the show, and she's an urgent care medical director. She almost died during childbirth. Dr. BCW, as you're known, I have come to respect you as an expert, but also as a person, as a mom, and I'm so happy you're speaking out. I want to start with age and then move on to race and personal experience. CDC found the older the mother, the higher the likelihood of death. Do you think that maternal mortality is going to keep going up as women continue having babies older?
I do. I think that rate is going to continue to go up because there are so many different factors that we have not invested in that could prevent those rates from going up. So, although, yes, when you're older, that does increase your risk. However, especially in the US, we still have such a robust healthcare system that we have to look at why those numbers are going up and find ways to really reduce it. And it's possible.
Mm-hmm. The matter of race is central to a lot of these numbers. Black mothers have the highest mortality rate in America than Native American numbers. And I guess I should note that maternal mortality, it's rising across all races, all ethnicities. And you've actually spoken recently by this. I think you spoke for about 13 minutes, and I watched the video. It's very moving. I hope people watch the whole thing. But you had a really scary experience. Could you share a little bit?
Yes, I did. We have heard the numbers chance about Black women dying 3 to 4 over the rate of white women in childbirth. And often we hear it's an access issue. Well, I wanted to share my personal story. As a physician and as a Black mom, I almost died. And so I wanted to share it's beyond access. And so I was able to talk about the statistics, other stories such as Serena Williams, as well as my personal story. I had just finished delivering my second daughter, and I knew something wasn't right. And I shared that, and I was ignored, and I almost died. I was, thank goodness my husband was able to advocate for me. I was taken back to the OR and found to be bleeding internally, and I was transfused and hospitalized for 2 weeks. So I hope by sharing my story that this will raise awareness and also provide
Mhm.
solutions, that this should not happen. There is no reason for it to happen, and we can do better.
How do you think of that push-pull of data versus instinct? Because your nurse stepped in, she reassured you, and you knew I should be fine, and I don't want to look hysterical. But your instinct said something else entirely. I assume that happens daily where these two things come into conflict.
It does. When the patient is stating something is wrong, we have to, as a hospital system professionals, look into that and take every single concern seriously. Because I share how, unconscious bias, where we have our own perceived perceptions of what that person is feeling. And unfortunately, that removes or dilutes our ability to take in what someone's sharing. So, as a medical director and a physician, I said something's wrong, and I knew it. And I
Mhm.
was continued to, be dismissed. You're fine. Everything is fine. So we have to continue to look at how can we educate our healthcare professionals? How can we continue to empower our patients to, speak up when something's wrong? And that's what my hope is through my, recent talk, my TEDx talk titled "Do No Harm."
Mhm.
I hope I can move that needle and help provide solutions to this ongoing problem.
Yeah, it really is an important story, and I was just thinking this through of implications, and it's really thought provoking. A lot of these deaths are preventable, and I thought, where do we begin? Do we begin with, is it listening? Is it pre-birth health? Is it having doctors and nurses of similar backgrounds who might facilitate a little bit of trust and communication with the patient? Should we change how we treat older moms? Where do you think is the number one place we can start?
The first part is acknowledging that there is an issue and then investing in listening to our patients and then responding to our patients. And I think that part is so vital because often people talk about access, and you can have the best access in the world, but if you don't hear what that patient is stating, and even more, if you don't react to what they're telling you, we can't provide change or produce change with this ongoing issue. So, as you mentioned, it's a blend of things, but we have the opportunity through stories and through data to make a difference.
That is a great point. Listening, yes. And then what? Action. Dr. Bio Curry-Winchell, thank you for sharing your story. And by the way, thank you for sharing your beautiful family with us online. I love your little girls. They're so cute. And we're glad to have you here, especially after this story.
Thank you.
All right. We will be back with more Scripps News tonight in just a moment.